Good afternoon, everyone. My name is Derek West. I'm the inspector of our community services branch here at Thunder Bay Police. And the guests with my partners today are Lisa Beck from the Thunder Bay Regional Health Sciences Center and Jennifer Hislop, the CEO of the Community Mental Health Association, Thunder Bay branch. This news conference is being held to introduce to you a new pilot project that this partnership has entered into. It's with regards to our impact project. Thunder Bay has partnered with Thunder Bay branch of the Canadian Mental Health Association and in collaboration with the Thunder Bay Regional Health Sciences Center so that we can provide immediate assessment and supports through a joint crisis response model. The Integrated Mobile Police and Crisis Team, also known as IMPACT, was launched on January the 4th and will be in place for up to about a year. This team is comprised of one police officer and one crisis worker working together to respond to all mental health related calls for service that the police receive or are referred to from crisis on a 24-hour, 7-day-a-week basis. IMPACT is an expansion of our joint mobile crisis response team initiative, which is now a program, which was operated since June of 2018. Canadian Mental Health Association will still operate its two-person crisis response mobile team from 2 p.m. to 2 a.m. 7 days a week. The goal of the pilot is to reduce time in the emergency room department, divert individuals from having to attend the emergency while providing supports for individuals in the community. We kind of put it in a way that it's better service and support and intervention at the right time, right place, and by the right service. With that said, for myself, I'll refer to Jennifer Hislop for her statement.
Good afternoon, everyone. The IMPACT pilot project is the next logical step in the work that we have been doing with this tri-partnership, responding to mental health crises in the community. And I truly believe if we didn't have the partnership with the Thunder Bay Police to jointly respond to mental health crises, that we would be seeing an increased number who are experiencing a crisis who only interact with police, which, as we know, provincially and in our community, police should not be the first responders to a mental health crisis. If we look at the evidence, both in Thunder Bay and across all communities in Ontario who've had to over-rely on police managing mental health issues, these are the next logical steps in jointly responding to those situations. We had great success with our joint mobile crisis response team, as Inspector West mentioned, and to date, the IMPACT team is already making a difference in the community. So we really, again, the three partners really want to ensure that individuals in crisis receive care in the right place, at the right time by trained professionals, and avoid any unnecessary encounters with either law enforcement or unnecessary visits to the emergency department. So what we're doing in this partnership is to support individuals, to educate individuals and the community, advocacy for mental illness, and generate mental health and mental wellness for all. And I think the time is perfect for this next stage in our partnership, given what we're all experiencing through COVID as well. I'll turn it back to you, Derek.
Thank you. At this time, I'll introduce Lisa to give statements on behalf of her department.
Hi, good afternoon, everybody. Thank you for inviting me to this news conference today. The IMPACT team provides a valuable service to support our community, to combat mental health crisis and support patients with mental health issues. Providing care at the scene is a valuable asset, and mental health call that can be addressed in the community without having to come to the emergency department is ideal. If a visit is required, and additional medical intervention and assessment is required, the IMPACT team is so valuable in supporting the individual at the hospital by both being there to reassure the patient and also improve their patient experience. So thank you for this collaborative initiative. It really is making a difference in the people's lives within our community.
Thank you, Lisa. And just to give you some perspective, since 2018, our Joint Mobile Crisis Response Project has served well over 1,800 people through that model of working together with the crisis workers and the officers, attending scenes together when necessary. In the 3 short weeks since we've started, we've now had 71 encounters to support people through this project. And out of those, 33 people were diverted from the emergency room, and while only 18 were made presentations to the ER. Some of the other items that we found are occurring with regards to the team is also taking into account the virtual ER that the emergency room department has to offer, and helping people towards that process, and then other crisis supports in the community. So with that said, at this time, I'll open the floor for questions from media. If you could say who you're with and who you are directing the question to, that'd be great. I was trying to unmute.
Hi, Matt Pitts with CBC Thunder Bay. This is kind of an open question, I guess, for any of you, but other than the fact that this new program operates 24 hours a day, how does it differ from the Joint Mobile program?
I'll take that. So what you'll find is that this is directly a police officer and a crisis worker working together. They're in the same vehicle, and they attend crisis immediately. They're dedicated to attend these types of calls, and will attend all mental health calls while they're available. And to answer your question, the difference is that it's that immediate response with the crisis worker versus waiting for someone to show up.
It's Lisa Beck from Thunder Bay Regional. The other thing to really add, the difference that I've seen is that the crisis worker and the officer are actually responding together, arriving in unison with the patient in the emergency department, whereas in the past, the Joint Mobile Crisis Team, there were many instances where the crisis worker arrived separately from the officer. So collectively, they arrive together and support the individual while in the emergency department. And that's been a really great improvement.
And this team operates out of the police station and our traditional model of the Joint Mobile Crisis Response. The CMHA crisis staff were dispatched from our crisis office. So it's a different model for sure.
I'm Colin Redston with Country 105. I guess I'm asking how you did talk about some of the numbers and that it's gone well so far. Can you go into more detail about that? Like, it's off to a good start, especially, during lockdown and stuff.
Sure. So that was really important for us to recognize as we launched this. We had just begun the newest lockdown due to the second wave, and we realized that this could have added stress for members of our community. So it was really important for us to make sure that we put good protocols in place for the staff to ensure that they were safe coming to work and then while they were at work. But more importantly was that they would still be available to respond because that crisis is occurring in the community and would need to be addressed here in the community. So to make sure that somebody could attend and actually have do face-to-face interaction with people in crisis.
And I think that it's important to note that the success of the Joint Mobile project, which is now permanent, we worked really closely with the Northwest LHIN, who's the funder for CMHA, and kind of raised the question of how could we use the resources in a different way to increase the responses in the community. So we designed the impact team to be able to respond more quickly and swiftly, and hopefully demonstrate that this model of care is maybe even more critical than the way that we were running our Joint Mobile project before.
And it's Lisa Beck. I think to add to that, this is a particularly important period of time, as you alluded, during the pandemic, during the emergency stay-at-home order. It is so important that we, whenever possible, try and maintain residents within their home environment, preventing patients having to come to the emerge unnecessarily if they can be supported in the community with the resources and the impact team. So it really does add benefit from the spread of infection, and also the convenience of having the team go to the patient's home is really important during this particular challenging time.
Troy Charles here from TBT News. Inspector West, you're saying it's a 24/7 availability. I'm just curious, how many different crisis workers are there to rotate through those shifts, to go out with an officer?
Yes, thank you. It's set up for there to be 4 full-time members, four full-time crisis workers and 2 part-time workers, which that's the way the model's built. And so we filled almost all those shifts. We currently have the 4 full-time through CMHA, and they attend here at the police station, and they're still working on some more. And Jen can speak to that.
We're still recruiting for 2 more part-time positions to make the team full. So I think it's out there on Facebook. So if anybody's interested in an amazing experience, sign up.
Hi, it's Matt again from CBC. Can you just maybe give some specific examples of what different types of diversions look like?
Sorry, Matt, what diversions look like?
Yeah, just different types of diversions that would be available for people that are experiencing different types of crises.
The diversion can look in many ways. Lots of times it's having a good plan with, say, a family member or a good friend who can stay with the individual, develop an immediate crisis plan. Maybe the phone staff from CMHA can reach out to that individual and do check-ins over, the course of 24 hours. The next steps actually in this project is CMHA is funded for 5 safe beds, which we have had difficulty opening thanks to COVID, but that will be a diversion pathway for individuals who need extra support, but definitely don't need an emergency department visit, that the impact team can have direct access to the safe beds, or an individual could be stabilized and stay for up to 30 days.
Yeah, I have one more, Matt again from CBC. And sorry if I missed this during the introductory statements, but can somebody talk about the funding for this project and where that came from?
Sure, Matt, I can speak to that. So the crisis response program at CMHA is funded by the Northwest LHIN, and we worked with the LHIN to identify how we could shift our resources and have a further reach by creating this impact model. So the LHIN has been a partner in supporting this work since they initially funded us for the Joint Mobile project in 2018.
I'll add that part of that included training that occurred. So both the police officers and the crisis workers participated in crisis intervention training jointly, and that was part of what we did for funding and to prepare the team to work together.
So I think the heart of my question is this new funding, or is this the existing funding through Joint Mobile and kind of redirection of that program?
Yeah, there's no new funding, Matt. It's redirection of our current funding to be able to use it in a different way based on the needs of the community.
Thank you.
Sorry, one more question from Troy at TBT. I think I heard earlier on it was likely for a year implementation. Is there any chance it would get extended? Is this like a trial run as far as the funding goes? What's the status there?
I think that we decided to run a pilot. The funding exists as a part of our agreement with the LIN for Joint Mobile. The reason we chose to do a pilot was to really do some analysis of the model and the benefits of the model. So we've partnered with Lakehead University, who are going to do some good analysis as we move through our pilot and see what the outcomes are. And then we'll make a decision with our partners around, would we continue with this model or shift back to Joint Mobile, or perhaps a hybrid model of response.
Just one last one for me. Inspector West, I believe it was you at the beginning who said there have been 71 encounters through this program already since it launched on January 4th. Can you just maybe give some perspective, whether that's kind of an expected number that you would see, whether that's high volume, and how does that direct the program, I guess, as you're looking to evaluate it over the next 11 months?
So prior to the beginning of the launch, for the last 6 months, I've been reviewing what type of calls come in for police. And initially, or immediately when I saw the numbers come in, I saw that it was impactful, meaning that we were having a lot of encounters. And the feedback through the officers and crisis staff on the types of calls they're going to, they make sure that they can do everything to support our front line in attending any calls. So any mental health calls they'll be at, and also to support victims of crime. And even recently, they supported somebody that was going through a death notification due to a death in the family. So the impact is immediate, and that allows a transition from that immediate resource to a community resource, such as the Vickers program, which assists victims of crime or incident, along with other community supports through crisis.
I didn't say anything actually. I've muted my microphone, but not within Teams. Sorry about that.
Sure, if we still have some time, I do have another one that just came to me. I understand the Joint Mobile program ran 12 hours a day. I think you said it was 2 until 2. How much of a limitation was that, and how important is it to shift this new program to a 24/7 model?
Good question, Matt. We did analysis of the Joint Mobile project, or the work, and found that there was a huge barrier to only be able to operate from 2 to 2. that there was a high percentage of calls that the Joint Mobile team was not able to respond to because they were already out on a call or it was outside of their working hours. So there was probably over 40% of the time. So that was the other impetus to really explore an impact model of a true ride-along model to ensure that there was more opportunity for coverage in the community and not leaving police to kind of have to deal with mental health calls just on their own.
Hi, it's Lisa. Just to add to that, I think as we analyzed and really looked at changing the model, what we realized is that the emergency department were receiving patients in mental health crisis or with mental health concerns outside of those operating hours. So we really looked at the peak times and looked at times when we could model when patients have the highest time of arriving in the emergency department. And the difficulty was it was a 24-hour clock, any time of day or night. So this model really does support people in need 24/7. And that was difficult to predict with the original model just being offered during those 12-hour periods. So it's certainly much more comprehensive and more community-centered, recognizing that mental health occurs 24/7.
I'm good, thank you.
Sorry, I just one further question that I don't know if it was what Matt was trying to ask earlier about, like, has the number of calls that you guys have been to, is that sort of an unusually high or low number, or is it like not a remarkable number?
I think that these numbers that we've seen in the first few weeks are higher than what we expected. And it's hard to compare with the other model in terms of, they would average, say, 3 to 5 calls potentially in a 12-hour shift. So I think with this new model that we're going to see the number of interactions with individuals go up significantly.
Okay, I don't have any more questions. Thanks.
Sorry, I lied. Just one really quick question for Jennifer. When you mentioned the safe beds, is there an estimate for when those might be operational?
Oh, Matt, you asked the best questions. We are aiming for the end of February. We've had a huge challenge recruiting staff in the midst of COVID, so everything's ready to go. The space is all ready to go. So it's just getting the final staffing numbers in place. So our goal is end of February.
And then one final one for Inspector West. I know we talked about the mental health worker side of it, how there's the 4 full-time and 2 part-time positions, but are there dedicated officers specifically for this program, or are these workers paired with regular patrol officers?
Assuming you can hear me right now, we have dedicated patrol officers from the units who've been trained, and when it's their shift, we have 4 platoons, so we have 3 officers per platoon trained, and so the supervisors will assign them to the impact unit.
Thanks, everybody.
Thanks, media, for your interest.
Thank you.